ALL stands for Acute Lymphoblastic Leukemia or Lymphoma. ALL stands for Acute Lymphoblastic Leukemia or Lymphoma. It is the most common cancer of children. ALL is the most common cancer of children. It is the leading cause of cancer death in children. Leading cause of cancer death in children. The cell of origin is precursor B or T cell. Precursor B or T cell, that's the cell of origin for ALL. Precursor B and T cell is the cell of origin for ALL. Age less than 15 years, that is in children. Age of ALL in less than 15 years. Sex, boys are more affected than girls. Types of ALL: BALL is more common than TALL. BALL is more common than TALL. BALL is more common than TALL. Genetic alteration: TALLs में gain of function mutation in Notch1 gene. TALL में there is gain of function mutation of Notch1 gene. BALL में loss of function mutation of PAX5, E2A and EBF gene. PAX5, E2A and EBF gene. BALL में loss of function mutation of PAX5, E2A and EBF gene. PAX5, E2A and EBF gene. BALL में there is loss of function mutation of PAX5, E2A and EBF. PAX5, E2A and EBF. And hyperploidy is common. Genetic alterations: in case of TALL, there is gain of function mutation of Notch1 gene. BALL, loss of function mutation in PAX5, E2A and EBF gene. And hyperploidy is common in ALL. Pathogenesis: genetic aberrations block the maturation of the lymphoid progenitors with their proliferation and survival. So the genetic aberrations will block the maturation of the lymphoid progenitors with their proliferation and survival. Genetic aberrations block the maturation of lymphoid progenitors. FAB classification: French American British classification. FAB classification: French American British classification. FAB classifies ALL into L1, L2 and L3. FAB, that is French American British classification, classifies ALL into L1, L2 and L3. Clinical presentation: fatigue, weakness, recurrent infections with fever and bleeding manifestations. There is thrombocytopenia, so there will be bleeding manifestations, recurrent infection with fever, and fatigue and weakness. Fatigue, weakness, recurrent infections with fever and bleeding manifestation. Bone pain, generalized lymphadenopathy, splenomegaly, hepatomegaly, and testicular enlargement. There is testicular enlargement in case of ALL. Bone pain, generalized lymphadenopathy, splenomegaly, hepatomegaly, and testicular enlargement. Headache, vomiting, nerve palsies with CNS involvement. There is headache, vomiting, nerve palsies with CNS involvement. Headache, vomiting. There is headache, vomiting, nerve palsies with CNS involvement. Okay, so the clinical presentations: recurrent infection with fever, bleeding manifestation, lymphadenopathy, splenomegaly, hepatomegaly, testicular enlargement, headache, vomiting, nerve palsies, and CNS involvement. Investigations or laboratory diagnosis of ALL. Peripheral smear will show anemia, neutropenia and thrombocytopenia. Anemia, neutropenia and thrombocytopenia. Total leukocyte count is variable with many lymphoblasts. So as it is acute lymphoblastic leukemia, there will be many lymphoblasts. There is marked leukocytosis with many lymphoblasts. You will also find smudge cells. Investigation: peripheral smear shows anemia, neutropenia, and thrombocytopenia. Total leukocyte count is variable with many lymphoblasts. Bone marrow: hypocellular marrow showing many lymphoblasts with interspersed macrophages impart a starry sky appearance. Bone marrow shows hypocellular marrow showing many lymphoblasts. Hypocellular marrow with many lymphoblasts with interspersed macrophages impart a starry sky appearance. So the bone marrow is hypocellular and it has many lymphoblasts which are interspersed by the macrophages, and this imparts a starry sky appearance. Lymphoblast: these are immature cells having scant agranular basophilic cytoplasm. Lymphoblast blast है, that means immature. Immature cells having scant agranular basophilic cytoplasm. Scant agranular basic cytoplasm, scant agranular basophilic cytoplasm and nuclei with delicate and finely stippled chromatin and small nucleoli. The nuclear membrane is often deeply divided, imparting a convoluted appearance. So lymphoblasts are immature cells having scant agranular basophilic cytoplasm. Immature cells having scant agranular basophilic cytoplasm, scant agranular basophilic cytoplasm and nuclei with delicate and finely stippled chromatin and small nucleoli. The nucleoli is small, cytoplasm is scant agranular basophilic and nuclei, and the chromatin is delicate and finely stippled, and it has a small nucleoli. The nuclear membrane is often subdivided, often deeply subdivided, imparting a convoluted appearance. The nuclear membrane is often subdivided, imparting a convoluted appearance. Lymphoblasts are immature cells having scant agranular basophilic cytoplasm, scant agranular basophilic cytoplasm and nuclei with delicate and finely stippled chromatin and small nucleoli. Cytoplasm scant agranular and basophilic, chromatin delicate and finely stippled, and the nucleoli is small. The nuclear membrane is often deeply subdivided, imparting a convoluted appearance. So according to FEB classification, ALL is of three types: L1, L2, L3. L1 blasts are small, homogeneous with scanty cytoplasm and indistinct nucleoli. L1 blasts are small and homogeneous with scanty cytoplasm. Blasts are small, homogeneous with scanty cytoplasm and indistinct nucleoli. L2 blasts are large, heterogeneous with moderate cytoplasm and 1-2 nucleoli. L3 blasts are large, homogeneous with moderate basophilic cytoplasm, having prominent nucleoli and 1-2 prominent, having prominent vacuoles and 1-2 prominent nucleoli. So L1 में blast is small and homogeneous. It has scanty cytoplasm with indistinct nucleoli. L2 में blast are large and heterogeneous with moderate cytoplasm and 1-2 nucleoli. L3 blasts are large, homogeneous with moderate basophilic cytoplasm, having prominent vacuoles and 1-2 prominent nucleoli. L1 blasts are small and homogeneous with scanty cytoplasm and indistinct nucleoli. L2 blasts are large and heterogeneous with moderate cytoplasm and 1-2 nucleoli. L3 blasts are large and homogeneous with moderate basophilic cytoplasm having prominent vacuoles and 1-2 prominent nucleoli. Cytochemistry, lymphoblasts are myeloperoxidase negative and pass positive. Myeloperoxidase negative and pass positive. Lymphoblasts are myeloperoxidase negative and pass positive. Immunophenotypic BALL is positive for CD19, 20, 21, 22 and 10, and cytoplasmic heavy chains. BALL is positive for CD10, 19, 20, 21 and 22. BALL is positive for CD10, 19, 20, 21, 22, and TALL is positive for CD2, 3, 5 and 7. BALL is positive for CD19, 20, 21, 22, and TALL is positive for CD2, 3, 5 and 7. BALL is positive for CD10, 19, 20, 21, 22. TALL is positive for CD2, 3, 5 and 7. TALL is positive for CD2, 3, 5 and 7. BALL is positive for CD10, 19, 20, 21, 22. TALL for CD2, 3, 5 and 7. Prognosis of ALL: worse prognosis with age less than 2 years, presentation in adolescence or adulthood, peripheral blood blast cells is greater than 1 lakh per microliter. So worse prognosis if the age is less than 2 years or the presentation is there in the adolescence or adulthood, and peripheral blast cells and peripheral blood blast count is greater than 1 lakh per microliter. Worst prognosis if age less than 2 years, presentation in adolescence or adulthood, peripheral blood blast count is greater than 1 lakh per microliter. Favorable prognosis if the age is between 2 to 10 years, a low white cell count, hyperdiploidy, presence of T12, 21, that is translocation between 12 and 21 chromosome, trisomy of chromosome 4, 7 and 10. So favorable prognosis if the age is between 2 to 10 years. अगर 2 से कम है then worse prognosis, 2 to 10 years then favorable prognosis. A low white cell count is a favorable prognosis. Hyperdiploidy, presence of translocation 12, 21 and trisomy of chromosome 4, 7 and 10. Favorable prognosis of ALL includes age between 4 to 10 years, hyperdiploidy, presence of translocation 12, 21, a low white cell count and trisomy of the chromosome 4, 7 and 10. Trisomy of chromosome 4, 7 and 10. Worse prognosis if the age is less than 2 years, presentation in adolescence or adulthood, and the peripheral blood cell count is greater than 1 lakh per microliter.